We're live now. Okay, great. So let me quickly share my screen. So good evening, everyone. Welcome to another session on bladder cancer awareness. As some of you may already know, May is the month of bladder cancer awareness, and we've been trying to do a series covering various aspects of bladder cancer, from understanding the symptoms to looking at treatment and understanding treatment options and how to navigate those treatment choices, living well with bladder cancer when you are a survivor who may be in remission or may not be in remission. And we are here again today to talk about the symptoms of bladder cancer to ensure that you understand them better and ensure that you get an early diagnosis, because as all of us know, in cancer, early diagnosis saves lives. So let me quickly, as I said, we've been doing a lot of these sessions on bladder cancer. We've been talking about navigating treatment choices, and we've done a earlier session on knowing symptoms. For all of those who may be new to Patients Engage, we are an online platform, and I'm Aparna Mittal. I'm the founder of Patients Engage and the moderator of this session. We've also got other resources for bladder cancer patients or cancer patients related to bladder cancer. So psychosocial effects of urostomy bags, dealing with, sometimes they also have colon cancer. So issues around colon cancer, tobacco is a risk. So how to quit tobacco, and a couple of other topics on talking to children about your cancer. Guidance to our attendees. The information here does not replace a medical consultation, so please consult either your own doctor for specific medical issues, or you can reach out to any of our panelist doctors for any medical consultation. This session is being recorded, so if you're logged into Zoom, please post the questions on the Q&A. If you're on Facebook or YouTube, you can put your questions there, we'll pick it up. And as always, you can write to us at editor@patientsengage.com. Make sure you follow us on our social media pages, because we keep putting out content every day. So follow us on our Facebook page, Twitter, YouTube, and Instagram, and check out our website, patientsengage.com. So let me quickly introduce our panel. We are very pleased to have with us two esteemed doctors who've taken time today at the end of a long day. So we've got with us Dr. C.T. Satheesh, who's consultant and professor, medical and hemato oncology, and director of clinical trials at HCG Bangalore. He's a senior oncologist with over 14 years of experience. His areas of specialization include pediatric malignancies, lymphomas, and gynecological cancers, along with breast, lung cancers, and cancer genomics. He has so far handled more than 20,000 cases and received extensive training in essentials of palliative care and clinical placement in palliative care from IAPC. He's involved in various clinical trials on cancer research and has more than 50 national and international publications to his credit. We also have with us Dr. Nikhil Haridas, Assistant Professor and Consultant, Department of Medical Oncology and Hematology, Amrita Institute of Medical Sciences, Kochi. He's an eminent clinician based in Kochi with over 7 years of experience, received medical training from Kerala University of Health Sciences, Thrissur, Kerala, and Rajiv Gandhi University of Health Sciences, Bangalore. His areas of interest include stem cell and other cellular therapy, gastrointestinal oncology, genitourinary oncology, molecular oncology, non-Hodgkin's lymphoma. He's performed more than 20 allogenic stem cell transplants, including haplotransplants, along with autologous stem cell transplant till date. And I think, yes, we also need to acknowledge that we are being supported by Merck and Pfizer Alliance. They're committed to improve outcomes for patients. So with that, let me quickly get started with the discussion. So thank you, Dr. Haridas and Dr. Satheesh, for joining us today. Let's get started. Dr. Satheesh, if you can start with, what is a urinary bladder? Where is it located? What is its function?
Thanks, Aparna, for a kind introduction. Yeah, bladder is a hollow organ. It is a ball like that. It is going to function as a collecting a urine when it is say when it is a urine is a waste product from the our kidneys is going to release. It's going to store and is having a function to fill, and when is we want to evacuate, is able to evacuate from the when needed role. It is like that both male and female they're having in a pelvic in a deep pelvis. This is regarding the bladder.
Okay. And how does cancer affect the functioning of this organ? Dr. Satheesh, if you can just
Yeah,
continue. Yeah.
yeah. This cancer definitely is going to affect in the like a urine bladder normal function. What are the storage going to affect actually? They'll have an increased frequency, they evacuate, and sometimes they'll have blood like is bleeding from the urine, and also they'll have a urine blockade can happen, and also they'll have a like a spread to the regional organ, surrounding organ. It can go to the rectum, and even in female it can go to the vagina. They can have a they can have a urine leaking from the vagina, and motion is coming from the urine is leaking to the they'll have a fistula can happen, and also spread to the regional organ, back pain, and spread to the other organ. They'll have a fatigue, weight loss, like various like based on the how the cancer is spread to which region, based on that it can happen.
Right. Thank you, Dr. Satheesh. Dr. Haridas, what are the symptoms and signs of urinary bladder cancer?
One of the more common symptoms or the complaints which the patient is going to present with the bladder cancer is going to be blood in urine, or as the medical term for it is hematuria. Now, this most may be painless. Very rarely it may be painful. Usually it is painless in nature, and that may be the reason why they come for evaluation of these symptoms. There can also be symptoms, as sir had already mentioned, that it's a
I think we lost him. I think we've lost Dr. Haridas. Still showing it. We give him a minute, otherwise, Dr. Satheesh, we might ask you to continue.
We'll wait for just a few seconds. Then
yeah. I think he's probably rejoining.
I'm sorry, we lost Wi-Fi for a second over there.
Not a
I
problem.
don't know where I got cut off because I was
you were saying that
talking for a while before.
Right. No, you said
so,
yeah, go ahead.
Please go ahead.
No, you were saying that as Dr. Satheesh was saying
that
right.
Yeah, so the passage of blood and urine is going to be your common symptom. At the same time, since it's a organ for storage of the urine, so issues related to the, frequent passage of urine can also be a symptom. There may be pain while passing urine. And also, if it invades the nearby organs, your symptoms may be related to that particular organ. There may be a flank pain if it goes to the nearby nodes, and of course, the symptoms also. Yeah.
Right. Dr. Satheesh, one of the big issues that happens with the diagnosis of bladder cancer is it gets often confused as a UTI, urinary tract infection initially, or sometimes even a kidney infection. So how can that be differentiated? Can a patient make that distinction, or how do they go about that?
Yeah, it is definitely is a very confusing. Both the like urinary tract infection or kidney infection or bladder cancer, they mimic almost alike. See, like the most thing is a there are common symptoms that are favoring towards by symptom wise. And it is not like only symptom wise I'm going to diagnose a cancer. See, like if you come that like a bladder cancer, they try to have more of blood, urine painless, what Dr. Nikhil was telling. And also like urine frequency also still you can get, or sometimes based on which is the location of the tumor, you can have a retention, you can be there. That's one thing. And also not only this one, they can have a like the urinary tract infection. You can have a blood in the urine also can get, but they'll have a more of burning sensation frequency. And bladder cancer, if the tumor is located, even without blood is filling, they'll try to have frequency of urination will be there. And also, like based on the that tumor is located, like respect to other organ, you can have additional symptoms. This is a symptom wise, but definitely we have to require the help of the like diagnostic test, urine test, and imaging, ultrasound, CT scan. And with that, we are able to urine culture. So we are able to associate urinary tract infection, bladder, we are able to differentiate.
Right. Thank you. And obviously when you get a symptom like that, you first go to a GP who might first treat you with the urinary tract infection. They'll probably assume, they may do a culture, etc. At what stage should they be referring you? They've tried maybe something and it doesn't work. When should they be referring you to a patient to a oncologist, or for any tests, etc.? How does that distinction happen?
Yeah, distinction, like I want to convey that all you like hematuria should not consider as a bladder cancer. I want to say that like it is that they're confusing between the symptom, both the diseases. If the like a frequency of maturation, your hematuria, it is persisting, it is crossing beyond 4 to 6 weeks, something wrong. It is not a normal infection. By the time a patient may be exposed to the like if he visited a doctor, they may be exposed to antibiotic. It is not resolving something really wrong. It is not a plain infection. It is maybe something wrong. Definitely they have to visit. I'm telling you, like not wait for a couple of months, 6 months, 3 months, like you have to wait. If it's like is not resolving by 4 to 6 weeks, like definitely you have to visit the doctor. But you try to address, they can talk to either local physician, whether you have to get a urine infection, you are not getting diagnosis, at least simple one ultrasound. That's what my request. Can request a doctor, and doctor also at least there. If you visit the doctor, they try to die.
Right. Thank you. Thank you. I guess it's also more important because often, in India, people treat themselves by just getting antibiotics directly from the pharmacy, right? So I think that's why it's important to get that message out. Dr. Haridas, what is the process of diagnosing bladder cancer? I think you are on, yeah. What's the diagnostic testing required? Dr. Haridas?
I think one of the simpler diagnostic tests right now, when a patient is, as I mentioned already, the symptom is going to be that of a passage of blood and urine. One of the simpler tests that we are doing, which is not exactly gold standard, but that can be done, is looking for a malignant cells in the urine. I mean, we are going to do the routine. One of the first DDs when you have a patient who has a very short history, as you mentioned already, can be a urinary infection. So you're going to send cultures, you're going to look for pus cells in the urine. At the same time, sending an urine, what we call as a urine cytology, urine for malignant cytology, is an test that can be done. Similarly, doing an ultrasound abdomen may reveal some other pathology, some other, may reveal the disease or process. One of the more important investigations, which is little more specific, would be doing a cystoscopy, that is passing of a flexible camera, that is endoscopy through the urethra to the bladder, and getting it examined, usually done by an urologist or a uro-oncologist. Now, this would be the basic set of investigations that we do in a patient in whom we suspect bladder cancer. Now, later on, as we, based on the findings of these reports, we may do the entire, blood evaluation, the complete blood counts, the kidney functions, and, then based on these, whatever results we are getting, we need to further evaluate. We may end up doing an CT of the urinary bladder or the CT pyelogram and CT abdomen. And if it's a we are suspecting advanced disease, there's in fact nowadays a role for a what we know say as a whole body PET CT.
Right. Okay. Thank you. Dr. Satheesh, what are the types of bladder cancers? Are there types of bladder cancers, and what are the stages, for both types of bladder cancers?
Yeah, there is we'll divide the bladder cancer into based on the clinical aggressive nature like that. Is a localized, is a non-muscle invasive cancer or invasive muscle bladder cancer. That's the one thing we'll tell. And if it's spread beyond the bladder, it is advanced bladder cancer. This is based on the clinical presentation. And by if you do the test, cancer is confirmed. Most commonly, it is a type like the transitional cancer. It is more than 90%. Next, other common is a squamous cell type. We'll see commonly in the bladder cancer. You may find a rare type. Sometimes you can see sarcoma. Sometimes you may see the like small cell type. Very, very rare variant we can see. Most commonly, transitional carcinoma bladder is the more commonly we'll see.
Right. And in terms of the stages of bladder cancer, if you can explain from a patient.
Is like if the tumor is limited to the like bladder, like it may be like in the inner layer, that it may be superficial bladder cancer, we'll see that will be treated by the what Dr. Nikhil was telling, by how we'll do the endoscopy like that. We'll put a past tube with the camera fixed. Actually, we can visualize the bladder and we can remove that superficial tumor. It is not invading depth. Actually, we can treat. This is a superficial bladder cancer. In depth, actually based on the early tumor, they'll try to that is a stage past C3 if they're like the tumor is going towards the blood wall, and regional like some lymph node spread can be there in the pelvis. This is like a stage 3. If that disease is spread beyond that urine bladder, it can spread to the rectum, prostate in the male or female. It can come to the uterine organ. It is a locally advanced, that is a stage 4A will tell. If it's going beyond that one, the pelvis, it is can spread to the abdomen, lungs, bone. This is commonly we'll see that most commonly will go to the bone, next in lung and abdomen. This is like it is a stage 4 disease will tell. There, those people will tell non-curable disease. Will be treated by majority with the medical management along with the local symptoms, how we address based on the whether it's a blockade of the urinary tract system or in the bladder like that is, and a bowel system, whether it's a blocking of the rectum. We are based on the stage we are going to deal with the treatment.
Right. Okay. Dr. Haridas, in terms of the treatment of bladder cancer, how does that? What are the options that are available to people, and how does that? How does stages affect the treatment?
Again, the stages, the treatment options available in a bladder cancer are going to be based on the stage. For example, in the very, very early stage, that is the non-muscle invasive or the superficial bladder cancers, the surgical resection via the cystoscope or the endoscopic tube, it is called as TURB, transurethral resection of the bladder tumor, and also installation of some either biological agents or chemotherapy agents into the bladder form a part of the treatment.
Right.
If the patient is having a muscle invasive disease, this can also be divided into two broad categories for simple understanding. One can be the localized disease, that means still within the bladder. It's not very advanced, as Satheesh sir had mentioned. These will be the stage 2 patients. They can be treated, one of standard of care. They can be treated either by giving what we call as the chemotherapy before a surgery. In certain cases, patients who don't want surgery involves removal of the bladder. In some cases, we can do a bladder and create a new bladder. While we may not be the expert in talking about the various surgical techniques, but there exists techniques to create a new bladder or a new bladder. Surgical resection usually is the standard of care. But in patients who don't want, because there is a surgical resection of the entire bladder, you'll have to have a urostomy bag, and you may have what is called a ileal conduit. You may create a pseudo connection to the abdomen to pass your urine via this thing. So There may be patients who may not want that, and they opt for what is called bladder preservation protocols, which may be a treatment of with radiation and some chemotherapy after maximally reducing the disease load. Now, for very advanced disease, again, generally chemotherapy prior to surgery is given, and then reassess, and they do a radical surgery. Radical surgery includes removal of bladder and the nearby what you call as a regional lymph nodes. Now, as sir mentioned, in stage 4 disease, 4A, 4B, very advanced disease, the intent of treatment isn't cure. So we may take a step back. If patient is fit, they can receive some palliative intent chemotherapy. They can also receive some, palliative intent radiation. If they have a lot of symptoms, the severe bleeding from the bladder, you can give some radiation to just stop the bleeding. If there is some other distant, let's say the cancer has gone to the bone, as I mentioned, bone is the most common site. You may have severe bone pain that can also be treated with some palliative radiation. And also, at this, newer, there are some drugs also being developed. Like even if chemotherapy doesn't work, we can try other groups of drugs like immunotherapy and targeted therapy.
Right, right. Dr. Satheesh, what is the prognosis for a person with bladder cancer these days?
Yeah, definitely. The prognosis of the bladder cancer depend on the stage of the disease. It's like compared to other cancer in the body, definitely is better than the other organs. 5 year generally survival rate, if you say that it is almost like more than 60% generally 5 years. Okay. But majority of the presentation will be there, almost more than 35 to 40% they'll present in the early stage.
Right.
The presentation early stage, definitely they're having a curative intent. If you have that combined model, it can be like a surgery. Most majority is important as a surgery, and with the systemic therapy or like local biological therapy or chemical therapy in the bladder in early cancer, definitely their prognosis is very good. The early cancer, they're having a tendency to have a survival is more actually. But if they are going for a intermediate stage, that local advanced is there, they're trying for the first will give the what Nikhil was telling, will give the chemotherapy to reduce, shrink the tumor before going for a definitive surgery. Then we'll understand the biology, how they're responding to the tumor, the other additional advantage, and also advantage is there to reconstruct the bladder and preserve the bladder preservation surgery. That's what is surgery is going in a very advanced, all the field, medical oncology, radiation oncology, all the thing. They try to preserve as much to improve the quality of life, and later like try to go for a curative intent. There are thing I told you, stage 4A or B, that we try to address with the systemic therapy. We try to go there. That the prognosis is not good as like early stage. Like intermediate stage, they can survive like we 5 year survival rate. We can say around like 40 to 50%. The stage 4, we can say that stage the survival 5 year survival rate up to less than 10%.
Okay. Right. Okay. Thank you. And are there any differences in either the treatment or the prognosis or the way this disease manifests by gender?
Yeah, like gender, like most commonly it present in the male, but almost 5 times higher than the female. That's the one thing. And the other thing is in the male, they try to have a little bit more advanced, like muscle invasiveness is more common than the female. That's the one, even though incidence is less and invasiveness of tumor is less common in the female compared to male. And also they try to have a like prognosis, like if you compare by stage wise all the things, the survival rate is almost similar. There's no much difference. And prognosis also like almost similar. Bladder type of cancer also almost similar. But only thing is nature, what I said is like advanced nature, presentation, muscle invasion means you are trying to have more of intermediate stage or advanced stage is more common in male compared to female. That's why prognosis generally we feel female slightly favor percentage. The incidence is less.
Right. Thank you. Dr. Haridas, what are the risk factors for bladder cancer? So that people who are at risk or etc., and what can they do to reduce their risk?
Family history has an implication. I mean, people with the family history have to be careful of bladder cancer, have to be careful about that. And of course, as we say, for most of the cancers, smoking is a huge risk factor. It doubles the incidence is almost 5 times, 4 to 5 times that of non-smokers.
Mm,
That may also explain the male preponderance. Uh, Previously, I think long time now, it may not be very valid. Previously, some aniline dyes, some particular chemicals used in certain industries and all were direct causative for these cancers. Now that we are aware about it, so those risks are reduced, or those are labeled as hazardous materials and kept away from work environment. And uh, also, some chronic, there is a implication for, chronic recurrent irritation of the bladder, maybe in form of a chronic urinary infections. Also, certain very rare type of parasitic infestation of the bladder in some other countries that implicated in the formation of cancer.
right,
But the
right,
major risk factor I would like to again stress in such a forum is that smoking remains a risk factor.
right. Thank you. Thank you. Um, One question we've been asked is, can a person lead a normal life after removal of the urinary bladder?
Yes.
Yeah.
With with an acceptance and with some form of an adjustment of your day-to-day living, our patients are usually managing the day-to-day activities. I have patients on the long-term follow. I would base my answer on their experience rather than what we see. They are able to do the day-to-day activities such as riding their two-wheelers, traveling by bus. They do take extra precautions.
Mm,
Initially, they were all self-conscious of the fact, especially those who have the urostomy bag, they were self-conscious about that. But over time, you also learn the what do you say, the coping tricks, mechanisms, including in your fashion choices to go about leading a normal life. And there are a lot of them who are able to do that. They're able to travel. They're able to, they may not be able to do all the activities with the comfort. For example, go to, let's say, swimming in the river or this thing, but they're able to do majority of the activities and they're happy with that.
right, right. Thank you. Thank you, Dr. Haridas. Uh, Dr. Satheesh, any final words for, especially focused on ensuring early diagnosis?
Yeah, like any cancer, like if you diagnose early, definitely that we can treat early, and with the available best method, we can able to cure in the best possible with the highest chance of cure. Coming to the bladder cancer per se, we are having that there is already the patient person is having a known history of bladder cancer, means maybe already superficial cancer is there, because the people they'll try to ignore. Once treatment has happened, cystoscopy, maybe the BCG or gemcitabine, when the treatment has happened, they may not have the follow properly. Again, they'll come back, land up after 2-3 years later. Again, the disease has come back, and like again, the widespread out. Because if you are having proper follow up, and if you know that is already risk factor for developing a recurrence and one more new cancer in that person, these are the people high risk category that you should have a follow up with the doctor. Then second factor, like that Nikhil was telling about that as the aging is most important, and smoking. I'll try to have that smoking not only bladder cancer per se, it is hazardous to the health for in multiple cancer, not only bladder, head and neck cancer, food bag cancer, lung cancer, and kidney cancer. Various cancer is there. Not only cancer, other thing, lung problem, and also like
Heart.
it's going to have cardiac problem, and even cerebral, multiple is it. That's the one thing. You try to have other, like other non-smoking habit, you try to have other healthy lifestyle change. That's what my suggestion actually. And other important factor is, yeah, we cannot prevent the aging. That's what aging is a definitely, you have to very prepare mentally for that. What are the precautionary, that's going for a stick to the healthy lifestyle, and what are the that screening test. See, the known family members are there, like that definitely he may be the culprit actually. As a like as a master health checkup, like okay, this is the aging advances, prostate enlargement will happen. Meantime, if you have a simple ultrasound, you may be able to pick up the early. Then the master health checkup will try to help up on picking up early bladder cancer. That's my suggestion. So they may be spending money in various aspects, but that's you have to take care of this. There's a minimum basic test you're supposed to have a screening for the cancer, and general health also supposed to do. That's what my suggestion. And also, like the most important, I know that it maybe all the people may not work in the industry. So those are working in the chemical industry, glass factories, all those things. They are one of the etiology underlying bladder cancer. The government and industry policies should be see their periodic follow up, checkup of them, screening for the bladder cancer. These kind of people should like try to identify them early, and if they're having identified something, they have to change their job and treat them early, and that's what risk should be reduced. And by knowing the risk, you should not keep quiet. Should get alert that one maybe the risk factor getting the bladder cancer. That's what my suggestion. Getting diagnosed, not only like I'm not telling you you're supposed to diagnose a cancer. I'm telling you risk is a preventable risk. Definitely you reduce the risk of going for a bladder cancer. The other things like we cannot avoidable the risk factor. I told aging, like those kind of things are definitely you have to go for the early modality to pick up a
Right.
That's what screening method is. That's what my suggestion.
Right. Thank you, Dr. Satheesh. Dr. Haridas,
Last
anything?
point I want to say is like the main thing is there the symptom they'll ignore, like mimic like infection, self medication. Please don't go for that. Please, like you have a relevant consulting the doctor. You get because many people are finding that just prescribe one pill, they'll be happy with that. They may not. If the persistent problem is not get relieved by more than 2 weeks, I think something is wrong. I have to get investigate. I have to consult the doctor. I'm not promoting a medication. I'm telling you, please consult a family doctor and the physician and surgeon, actually urologist nearby. They'll help you. That's what my suggestion.
Right. Thank you. Thank you. Dr. Haridas, anything final words from you to the audience?
I mean, again, the focus is on, unlike a lot of other cancers like breast and cervix and to some extent lung, where we can screen, there is no screening method for this disease. So as already sir has mentioned, I would like to highlight good healthy lifestyle, good healthy lifestyle, including avoidance of smoking and tobacco use. And as the symptoms come, see, the thing is that when it's an early stage disease, this has a 90% survival at 5 years. If it is a non-muscle, if it is, and you can see that when it becomes even stage 2, the survival drops to 70% for 5 years. And the last for stage 4 has less than 5% survival. So the early detection leads to early results. Do not delay evaluation of the blood and urine at least. So that's going to be the most common symptom.
Right.
And yes.
Okay. Thank you. Thank you, Dr. Haridas, and thank you, Dr. Satheesh, and thank you to the audience for watching. And as mentioned earlier, we have next on the 29th, we have one more session on can we prevent bladder cancer or prevent recurrence of bladder cancer. So do join us for that session. And you can follow our social media handles for the exact details. And thank you once again, Dr. Haridas and Dr. Satheesh, for supporting and educating people on bladder cancer, which is such a neglected area of conversation. So, asking everybody to at least to start with quit smoking or any tobacco use, and be aware. Don't let the fear of finding out what you have stop you from getting diagnosis. So make sure that you get a proper diagnosis.